Hello to all of our signing members. This is Katie Capps, Executive Director and co-founder of the Get the Medications Right Institute, here with an update on our activities from March and upcoming activities for April. We continue to grow both in membership numbers and funders. OneOhm and the Journal of Precision Medicine have joined as strategic partners. We're happy to have their leadership and expertise as part of our work groups. Executive members and strategic partners are crucial to the success of the Institute, and they support our activities through leadership and participation on our work groups, task forces, and learning network. We appreciate their time and financial contributions to overcome barriers to achieving medication optimization through comprehensive medication management and practice. So thank you to all of the organizations who play a huge part in leading the Institute in its mission and vision to get the medications right. Having dedicated members is crucial to our success. So if you'd like to learn more about becoming an executive member or a strategic partner, please contact us. Now, during each update, I've shared with you work that we're doing with employers as health plan sponsors. You know, employers want a better healthcare system. They want to decrease waste and ensure that their employees have access to effective, efficient, high-value care. They want to ensure that their employees have access to appropriate medications that are right for them. But there are few programs that offer integrated medication management services designed to get the medications right. Services that optimize use of all medications. That's why we have been designing resources to educate employer coalitions and benefit consultants, showing them a better way to manage medications through CMM in practice. We need comprehensive medication management. It should be adopted by health plans, and employers as health plan sponsors are the lever to get that done. So I'm excited to tell you that you should mark your calendar because later in April, we will be releasing our Employer Toolkit. The GTMR Institute recognizes that employers as health plan sponsors manage the health benefits of 49% of the country's total population. We also know, because they sign the check, they have much to gain from optimizing the medications involved in 80% of all treatment decisions. This toolkit explores the benefits of CMM for individuals and for the employers who pay for benefits. Research published in March 2018 reveals the waste to the system when the wrong drugs are prescribed, drugs are skipped, or drugs make people sicker, which in turn leads to an estimated 275,000 deaths a year. In financial terms, there's a $528 billion price tag attributed to non-optimized medication use. This is waste that can be avoided. Now, when using this toolkit, employers will be able to work with their pharmacy benefit managers, their medical carriers, their benefits consultants, and solution providers like pharmacogenomics vendors, and their employees. In the document, they'll find employer frequently asked questions, an employer infographic that outlines the economic argument, a guide to contracting for CMM, the lowdown on CMM and pharmacogenomics testing, use cases showing actual work in local communities, an outcomes document, the value framework for CMM, and a lot more. The toolkit was developed with guidance and support from GTMRX's Employer Task Force, and we hope the toolkit will be broadly disseminated. I'd like to thank the business coalitions that have been participating with us over the past year in the development of this toolkit. Now, to thank those coalitions that have worked with us, later this month, leading up to the launch of our Employer Toolkit, GTMRX will be hosting an exclusive webinar for our coalition groups. The webinar is sponsored by 10 of the nation's largest business coalitions, and it will provide their employer members a point of view on how buying right can impact cost and quality. During that webinar, we'll discuss why the current system of trial and error medication use must change to eliminate the health plan assets waste it creates, how comprehensive medication management is being used today to effectively transform and optimize medication use while achieving measurable positive treatment outcomes that save lives and save money. During the webinar, we'll talk about the value equation for employers for a new medication use process through CMM in practice. We'll also talk about how this applies to their work with PBMs, medical carriers, and other service providers that they contract with. So look to hear more about using a buy right strategy from our experts over the coming months through blogs, articles, and podcasts that the Institute sponsors. One example of a recent blog is from the Teachers Retirement System of Kentucky. Jane Gilbert talks about how one simple test can reveal how someone will respond to their medications. This is crucial information, and it can save millions of dollars across a patient population. As a matter of fact, the Teachers Retirement System of the state of Kentucky has successfully implemented a program that optimizes patients' medication. The TRS model can be replicated nationally. They've seen tremendous interest in doing just that. Read the blog from Jane Gilbert and also reference her 2019 issue brief, which outlines the savings and the economic opportunity of blending pharmacogenomics testing with CMM in practice. You can find that blog on our website at www.gtmr.org. Now, in another recent blog called Employer as Changemaker, Sandra Morris, former senior manager of U.S. benefits at Procter & Gamble and now senior advisor for the GTMR Institute, discusses where employers can begin to advocate for change to save lives and ultimately save money. Now, while many PBMs and health plans point to adherence programs as the only solution, we believe the problem is not solely the inability to keep people on medications. It's also failure to optimize medication use. This requires going upstream in the medication use process to first ensure every medication is appropriate, effective, safe, and that the patient is willing and able to take the medication as prescribed. Read Sandra's blog. It's about 4 minutes, and I think it'll offer you tremendous insight from an employer's point of view. Another blog that you may be interested in is Rita Shane's Wise Words and Guidance to the Employer Community as Health Plan Sponsors. Rita points out in her blog, your workforce is a population that is best served when it has the resources to achieve optimal health. CMM is a critical part of a team-based population health approach that identifies medication problems and mitigates risk. And I couldn't agree more with this. We typically see medication problems fall into 3 buckets: overuse, underuse, and misuse of medications. All 3 can contribute to higher cost and impact patient health. These problems can be detrimental in high-risk patients who often lack any single provider managing the whole patient picture. That's where the clinical pharmacist can add incredible value by taking on the role of the medication expert on the healthcare team and systematically evaluating all the patient's health issues, medications, lifestyle factors, and desired health goals to optimize medication regimes. Find this blog along with Sandra Morris's blog on the GTMREP's website. Now, I'm excited to tell you about an upcoming event that the Institute will be co-sponsoring with the Bipartisan Policy Center. This virtual event on April 6 from 10:30 a.m. to 12 o'clock p.m. will outline effective strategies to build vaccine confidence during the COVID-19 pandemic. During the event, GTMRX will announce the National Task Force, Building Vaccine Confidence in the Medical Neighborhood. As you know, vaccinating Americans is critical to preventing severe disease or death from COVID-19 and ultimately stopping the pandemic. It's also essential in getting people back to work, to play, and to living. To achieve widespread vaccination, engagement of the medical neighborhood is fundamental when implementing community programs designed to effectively build vaccine confidence. While we have seen encouraging vaccination rates, urgent action is needed to reach herd immunity, which experts estimate would require anywhere from 70 to 90% of the U.S. population being fully vaccinated. Now, the reasons people give about being skeptical about taking the coronavirus vaccine are complex. Building vaccine confidence requires proactive and thoughtful public awareness, education, and engagement of a variety of local stakeholders, including community members, primary care, pharmacists, schools, religious organizations, public health, and others. At the meeting on April the 6th, which I encourage all of you to register for, you'll hear opening remarks from Senator Bill Frist, former U.S. Senate Majority Leader, from Don Berwick, President Emeritus and Senior Fellow of the Institute for Healthcare Improvement and former Administrator of CMS, Anand Parekh, the Chief Medical Advisor of the Bipartisan Policy Center, as well as Karen Rimley, the Director of CDC's National Center on Birth Defects and Developmental Disabilities, as well as the Deputy Incident Manager for COVID-19 response. During the event, I have the pleasure of introducing the National Task Force. Now, following those opening remarks and introductory keynotes, you'll hear a panel moderated by Susan Denzer, Senior Policy Fellow with the Robert Margolis Center for Health Policy at Duke University. During that panel discussion, Susan will speak with a number of representatives of the medical neighborhood. I think that if you register for the event, you will be pleased with not only the outcome of the discussions, but what you learn from that day's proceedings. So be sure to register now at the link on the screen. You don't want to miss this. Now, on our next member call, I'll update you and tell you more about the newly formed GTMRX National Task Force that I'll be introducing during the April 6 meeting. The GTMRX National Task Force, Building Vaccine Confidence in the Medical Neighborhood, will begin meeting shortly after the BPC GTMRX event and will conclude its work at the end of June. So stay tuned. I'll give you more of an update on our next membership briefing. Now, finally, in case you missed it, we released a new episode of our Voices of Change podcast series featuring Dr. Julie England of OneOhm and her patient Mike. Together, we discussed Mike's journey through a systematic approach to evaluation and management of his medications. During the podcast, Dr. England tells listeners how comprehensive medication management combined with pharmacogenomics testing help target the correct therapy for Mike. Pharmacogenomics testing is the study of how a person's genes affect the way they respond to drugs. When utilized as a tool during the service delivery process of care, we call CMM, it puts the patient at the center of care, allowing us to target correct therapies and deliver care that is precise and personalized. During this podcast, you'll hear Mike's story before and after consulting Dr. England and his courageous battle to get his medications right. So take a listen on the Healthcare Now radio or at the link that you see here on the screen. So with that, thank you for listening to this update. Our sincerest gratitude goes out to all of our members, especially those who continue to work on the front lines, demonstrating bravery and commitment in the face of this challenging time. If you have any questions or would like to get involved with our work, please get in touch with us. We would love to have more hands on deck, offering their unique perspectives to support our work. Thank you for your continued support. Until next time, be well